Right now, an Eyewitness News Health Special, Coronavirus in Connecticut. Doctors answer your questions. Sponsored by Hartford Healthcare.
As the state of Connecticut begins to reopen, we know your number one priority is keeping you and your family safe and healthy.
I think we're striking a prudent balance here.
Should you go out? Is it safe? Will the virus surge again?
With this nasty virus coming, it's definitely changed a lot of things for us, so it's made it challenging.
Tonight, an Eyewitness News special, doctors answering your questions.
Good evening and welcome to an Eyewitness News special, the coronavirus in Connecticut, doctors answering your questions. I'm Kara Sundlin. Throughout the next 30 minutes, we'll be hearing from health experts from Hartford Hospital as they answer the questions that you, our viewers, have asked the most. So as we get adjusted to this new normal, people should not be afraid to seek medical care or visit the doctor. First up in our coronavirus in Connecticut special, the president and CEO of Hartford Healthcare, Jeffrey Flax. Thank you for being with us.
Oh, thank you. Good evening, Kara.
Good evening. You know, it's a question that's on everyone's mind as the state starts to reopen. How safe are we? Did we really flatten the curve?
Well, fortunately, the curve has flattened. We're about 55% below our peak of where we were in terms of treating COVID patients. So we've seen a very significant decline, which we're very grateful for. And we're seeing both the testing in the community to be fairly consistent and at a fairly low level of prevalence. So we're encouraged by the results, but we're monitoring it very, very carefully.
People are still nervous about going to the hospital. How have the hospitals emerged from the pandemic?
Kara, first of all, I'm so proud of the way all of our hospitals in the state have reacted and managed this crisis. You know, our gratitude to our frontline healthcare workers could not be greater. Everyone who's worked within our facilities, from our physicians, nurses, respiratory therapists, to all people working in support services and invaluable services like housekeeping and food services, they've been so careful, so attentive, and so brave and courageous in doing this work. But our hospitals are safe. In many ways, I describe them as the safest place to be anywhere within our community. We've put so many precautions in place, from visitation policies to screening every one of our staff members and any person who enters one of our buildings, to testing all people who are getting surgeries within our facilities. So many precautions, a focus on safety, on ensuring that we're here to take care of our community and under all purposes for, at any point in time, for all reasons.
And we definitely do want to thank everyone on your staff. They really have been the heroes, and I know they've had to deal with things they never imagined they'd have to deal with. We've been talking for weeks, Jeff, and I know you wanted to talk about hospitalizations going down, and they have. That's a key metric. But a lot of our viewers keep asking, but what about the fact that deaths and cases still continue to go up?
Well, this virus has been a deadly virus, and our hearts go out to the people who have had losses within their families, with their loved ones, within our community. There's been a mortality rate of close to 20% across the board for people admitted to hospitals. But thankfully, the vast majority of people have been treated at home by their primary care providers. And for the people who've been admitted to hospitals, about 80% are successfully being transitioned back to home, and they've beat this virus. So we've really celebrated the so many brave people who have come into the hospitals and left really very well. So it's really been a tremendous journey within our hospitals to care for people under such intense conditions.
And I know that the deaths always trend after we see the hospitalizations go down. But when you talk about testing and contact tracing, how important is that going to be as we move into the next phase?
Testing's critical, and I'm so pleased. First of all, there's more testing today than there has been at any point in time. We have 9 testing centers set up across Connecticut. We also have a mobile testing center, a pop-up center. So we're testing in churches in the community, community health centers. We're testing nursing homes. We're testing homeless shelters. We're testing the Department of Corrections officers today for the state and other first-line responders. So testing is critical for us to preserve a safe, secure environment across Connecticut. Testing and monitoring prevalence is very critical.
Should everyone at this point get tested, even the asymptomatic?
Well, over time, that's going to be evaluated. But today, testing is accessible. So people can get a test. They don't need a physician order when they don't have one. We have a mechanism to provide them an order from a practitioner. so that they're eligible for the test. So we're removing all barriers to testing, and many more people are getting testing today by virtue of self-selecting or attending any one of our drive-up locations or our pop-up locations when they're being advised by their provider or they feel it's appropriate based on their circumstances.
And a final question for you, Jeff, is that we know that telehealth visits have skyrocketed. Is that going to be the new normal? Would I, in the future, go to the doctor on Zoom?
You know, Kara, I keep describing everyone wants us to return to normal. And in many ways in our lives, we all want to return to normal. But I have to tell you, in healthcare, I don't want us to return to normal. I want us to be better than normal. This is one of those great examples. Telehealth is a game changer. We have done 141,000 individual patient telehealth and video visits. And what it allows us to do is we now have specialists that may not be in a certain location at a certain point in time in the state, but through telehealth, we're able to make it available 24 hours a day, 7 days a week. So it's about access, and we're providing our expertise more places, more reasonably, and more accessibly. So this is an important thing, and I hope it's going to emerge as we evolve now as one of the standards of care as we go forward. And it's an important part of community health and wellness.
Thank you, Jeff Flack, CEO and President of Hartford Healthcare. I know you just launched a 24-hour mental health hotline. We have much more on that coming up in our special tonight, but we want to thank you for being with us.
Thanks so much, Kara.
You're watching Coronavirus in Connecticut. Doctors answer your questions. Sponsored by Hartford Healthcare.
Welcome back to Coronavirus in Connecticut. Doctors answering your questions. We've had so many of you ask what is safe to do, how to stay healthy, even if this virus will come back. And joining us now to touch on some of your questions is Dr. Faika Chima. She is an infectious disease doctor at Hartford Hospital. Thank you so much for being with us.
Good evening, Kara. Thank you for having me.
So there's still so much to be learned, but what do we know now that's different from 2 months ago?
There is so much new information from this pandemic that we've learned. A couple of few points that I'm just going to quickly touch upon is that today we have approximately 5 million confirmed cases of COVID globally, of which 1.5 million approximately are in the United States alone. This means that a little bit less than 1/3 are here in America, and approximately to date we've seen about 94,000 deaths. This just really reflects and points to the fact that this virus is capable of spreading quite exponentially, and we've seen several thousand and million cases so far to date across the globe. One other important thing that we've learned from the pandemic so far, which I feel is really important to get the message out to the public, is asymptomatic or pre-symptomatic transmission accounts for 30 to 50% of the new cases. This is especially important as we start to reopen, get back to life and living. And we know that, physical distancing, keeping our 6 feet away from each other, wearing our masks, washing our hands, and also avoiding staying in closed or enclosed spaces where the risk and probability of sustained transmission is high, has been shown to really slow the spread of the virus.
Doctor, I do thank you so much, and we want to get some of our viewer questions in with you, and I know there are many, but let me ask you first. A lot of people are concerned about children and this new disease that could be linked to the virus. What's the latest?
So we're still learning a little bit about this. So far we know that there have been a cluster of cases in New York. There have been a few across from Spain and Italy. These children have been exposed to the virus, and about several weeks later they're presenting with these unusual inflammatory syndrome that presents in a way that is concerning. We still have a lot to learn, but we're keeping a close eye on it.
And Alicia in Windsor asked, can you get the coronavirus twice?
That is a great question. So far, what we know from the virus is that if you have been infected with this, you will develop some form of protection. Your immune system will develop some soldiers called antibody, and they will give you some form of protection. And those protection we're expecting and hoping will last you at least for this season. So the short answer is it's unlikely that if you've been infected once that you will get the infection again, at least this year. Okay,
and Shana from Terryville asked, can mosquitoes transfer the coronavirus?
I'm sorry, I had trouble hearing you, Carrie.
Shana from Terryville asks, can mosquitoes transfer the coronavirus?
Oh, that's a great question. The mosquitoes are not capable of transmitting the virus. We don't really know the origins of how this virus came about. There are some possible theories that it originated in bats, some through mammals and intermediary hosts, but we know that mosquito transmission of this virus is not reported.
Okay, and Lori in Colchester says, is it safe to take an airplane? The flight is 2 hours. My daughter has asthma.
So I know a lot of people have travels and plans to open and enjoy life in the summer. I'm going to spend some time really explaining this really well today. We do know that traveling by itself can increase your risk. We know that the virus got to the United States as somebody who was infected with the coronavirus, sat on a plane, and then arrived in the United States. Being on a plane itself, being exposed to the air or breathing the air does not increase risk of acquiring the infection. We know that because they follow really high quality standards of purification of the air, as well as filters that they use that we currently use in the hospitals in patients who have COVID-19 and are placed in isolation. So what really is important, that traveling by itself, so if you were to get into a cab to get to the airport or use a shuttle bus from your parking to the airport, stand in long lines or wait in a crowded waiting area, eat at the airport, and you're not being attentive to hand hygiene, those are all risk factors that can increase and be more likely responsible for acquiring the infection than just sitting on a plane.
Okay, thank you. And many viewers have asked, is it safe to swim? Can coronavirus be transmitted in a pool or at the beach as it starts to get warmer?
So I'm going to break that up into two questions. If you are swimming in a public pool, you just need to follow the guidelines, which is you need to be maintaining some level of physical distancing. If the pool is it's a day which is crowded at the pool, and if you're not capable of doing that, then it's probably not a good idea to go in the pool. If you're at a beach and you can maintain safe 6 feet distance, you're wearing a mask, if you come in close contact with people, then it's reasonable to enjoy those outdoor activities. My opinion on this as we reopen is it should not be all or none. I think we need to follow this basic guidelines, which means maintaining physical distance, wear your mask when you're outside the house, wash your hands, and avoid being in closed, crowded spaces.
Stacy in Vernon has asked, I have tested positive for COVID-19 antibodies. Am I immune to the virus or can I become infected again?
We're still learning a little bit about this. We don't have complete information yet. As an infectious disease specialist, we do know that when you get exposed to certain viruses, say if you have chickenpox or if you have measles, your body or your immune system will develop some level of protection called antibodies, and they can offer you some protection for a period of time. The information that we don't know at this time related to the coronavirus is if you do develop those antibodies, how protective they are and how long they will last.
Doctor, thank you so much for all of the information. I know people are hungry for it. We thank you for being with us, and we'll be back with much more from the doctors at Hartford Hospital right after this short break.